Now let's review the diagnostic tests that are used to confirm the diagnosis of human immunodeficiency virus. The diagnosis of HIV is achieved through a series of tests that are both highly sensitive and specific for viral antigens and human antibodies against those viral antigens. The most common test that's first performed in an individual that's suspected to have an infection with HIV is the antigen and antibody immunoassay, which detects a specific viral antigen of HIV. Do you remember which viral antigen is detected with this immunoassay? That would be viral capsid protein P24. Very good. These immunoassays detect the presence of this antigen as well as our body's IgG antibodies against this antigen. This test is then confirmed with a differentiation immunoassay, which differentiates between HIV-1 and HIV-2. If these immunoassays are inconclusive or there's high suspicion for HIV in the setting of a negative immunoassay, the nucleic acid amplification test is then performed. This is the most specific test for HIV infection. Once the diagnosis is confirmed, viral load is often measured to determine the levels of viral RNA in the serum. Viral load, in addition to CD4 count, are both diagnostic markers of how well the infection is being treated. So we monitor the viral load and CD4 count over time to assess how well the patient is responding to our systemic therapy. Now, the next important thing to cover when we're discussing HIV diagnosis is to talk about the criteria for the diagnosis of AIDS, or the acquired immune deficiency syndrome. There are 3 criteria to diagnose AIDS. Can you remember what those are? Well, it's when the CD4 count dips below 200 cells per millimeters cubed, when the patient has an AIDS-defining condition, as well as when the CD4 cell percentage is below 14%. And this is determined with a CBC with differential on routine laboratory work.